So for the past 3 years, we've had a lot of experience with Care Connections, where we take very high-risk patients who have 3 or more chronic medical conditions, mental health conditions, and lack other resources, and we enroll them in a very coordinated program of patient navigation, behavioral health interventions, medication management, and physician interaction. From that, we took the successes, and we really determined what the key resources were if we were to spread this across an entire geography. Lancaster General Health embarked on a program of population health management, and that really means working with groups of individuals to make sure that they stay well and they manage their health in very defined patterns. The natural evolution of this wound up that we deployed our care management teams called ambulatory collaborative care teams.
The ambulatory collaborative care teams are comprised of RNs, social workers, community health workers, as well as community pharmacists. We work as a collaborative approach to addressing the patient's needs, oftentimes referring back to the physician for guidance or elevating any issues or concerns that we may have discovered or sharing.
The patients that the ambulatory collaborative care teams work with are patients at risk of coming and going from the hospital or the emergency department. So we are really working with higher risk individuals from their healthcare status to make sure that we enroll them in this type of program.
While our program looks to manage those patients of a high risk, 10 or greater, we're also looking at those potential or rising risk patients and seeing how we can work with those individuals to lower their risk score and hopefully in turn reduce utilization.
We have a primary care network that spans Lancaster County, Lebanon, Chester, and even into York County. We have created a management team that oversees 6 to 7 of those practices based on a region, and the ambulatory care teams now overlie each of those regions and help create linkages between the practices and the offices.
I feel our patients can benefit from this program by having additional hands, eyes available to address their small needs. For instance, we have a particular patient who was very limited income, had other health issues and needs, but right now her priority was getting a pair of shoes for her daughter's wedding. So we were able to help facilitate that. And then she felt better. And then we can move on with the task at hand. But sometimes you have to address what the patient feels is important before you can get on to the more medical needs of the patient.
Well, I think part of Lancaster General Health's mission and vision for the community has always been to increase the wellness and health of the community. And one of the ways to do that is to keep people out of the hospital. This isn't typically a traditional business model in healthcare, and what we're realizing is that the value to the community is the exact opposite. Be here when you need it for really intensive services in the hospital or other situations such as the emergency department, but really to become a partner long-term in health and wellness. And of course, in the background on this is all the federal and state level changes around payment systems, helping to drive and shape this, and Lancaster General has been on the forefront of that.